Hey guys, welcome back to my channel. It's Jemecia Capri, the Nurse Practitioner Extraordinaire. And if you're new to my channel, welcome, welcome, welcome. So I'm back live, guys, and I have a request today. And I am going to give you guys some tips and tricks on how to ace your physical assessment or how to get through your physical assessment. And normally when you're in, nurse practitioner school or nursing school, hey, thank you for stopping by. I cannot see who you are, but thank you for coming. But anyway, when you're in nursing school or nurse practitioner school, you will have, no doubt, physical exam, physical checkoff at some point, whether that be live in front of an instructor or through video that you have to tape on someone. So the last time I went live, I had a request from Boss IG Live. She asked me to, how do I remember my physical assessment? So I wanted to come on and let you guys know how to remember your physical assessment and how to get it right every time. So I cannot go over the whole body, but I will try to go over as much as possible for the HEENT section of your exam. And you can apply these tips to every single section of your physical exam. But I'm going to tell you right now, there are about 4 to 5 tips that I'll tell you off the top, just right off the top, on how to prepare for these physical checkoffs. Now, a lot of you will have, like I said, a checkoff that is in person. So that means you have to get ready for that. And some of you will be able to put in you can practice on that and put that in. So main tips that I'm going to give you up front. Number 1, you will have to memorize. That's the bottom line. You will have to memorize. So number 2, what do you memorize? You have to memorize the checkoff sheet. Whatever the checkoff is going to be, you have to memorize that. Whatever the rubric is, you have to memorize that. So you have to memorize. Number 2, you have to relax and remember what you need to be doing in your exam. And so I did bring my model here today to show you guys. So I will be using the model to show you guys how to do that. The other thing is you're going to have to practice, practice, practice. So to get your exam right, you're going to have to do it over and over. It will get better with practice, but I'm telling you, don't wait until the last minute because you will be cramming. You'll get nervous and you will not be able to remember anything. And the goal is to get as much as you can from that checkoff sheet correct. So most of you, like I said, will either have a complete head to toe exam or you'll have a section that you have to do. When I'm doing checkoffs, when I see my students and I do checkoffs, we do different portions of the exam. And so today I'm going to go over some of HEENT exam and how you can memorize it or how you can remember how to get everything on the checkoff. But keep in mind, even if you memorize it, you have to practice it because it is it's timed most of the time. So you have to do it in a specific amount of time. Okay, so as I said, number 1, you have to remember to relax, remember to memorize, remember to practice. So the first thing you want to do when you start your exam, so like I said, I'm going to do an HEENT exam for you guys today. Hi, how are you? Thanks for stopping by. Is that Heisey King? Thank you so much for stopping by. So I'm going over how to do a physical exam and how to remember parts of the exam. So I'm only doing the HEENT portion. So when you first go in, you always check to see their general presentation. So you want to make sure that when you're getting checked off, you talk about the general presentation right off the bat, meaning they look like they're alert and oriented, they have a steady gait, they were able to get themselves up on the exam table, and they look to be fine. They don't look like they're in any acute distress. So make sure you do that right off the bat. And then if this is a checkoff situation, that's what we're talking about. So don't do this with a real live person because they're going to think you're crazy. But for your checkoff, for your exam, you want to make sure you get right into it because it is timed. So then you want to make sure that you have your rubric that you had and you have it memorized. Is the boy that said he subscribed? Oh, it's the boy. Oh, okay. Thank you. Thank you so much. So make sure that you have your rubric memorized or however you're going to do your exam. For me, when you're doing a head to toe physical assessment, then you're going to go from head to toe. So that just makes sense. So I have my person here with me so you can see. You want to go from head on down. So I'm going to do HEENT, such as what I said. So first, like I said, I noted how they look when they came in, and then I'm going to inspect. You always inspect first, and you do that by looking for symmetry. And you're going to note that everything's symmetrical. And the way that you do that is you look at the person. It seems so simple, but you will look at them and they will tell you based on what you see, everything that you need to be checking off and everything you need to talk about. So in this case, I would note that her face looks symmetrical. Her eyes look symmetrical. Her nose looks normal. It doesn't look like there's any deviation or anything wrong with her nose. Her lips look fine. They are moist. They're not cracked. They don't look like anything's wrong with them. Her face looks fine. I don't note any swelling or anything like that. And then you would also make sure that you touch the head and you feel for any lumps, bumps, or anything abnormal. And you note that and you say that. And then you talk about any facial swelling. You don't see any of that. Then you will just inspect everything you see. So in my case, I would probably first inspect the eyes because I see the eyes. I would note everything about the eyes. The eyes look symmetrical. I see the eyebrows symmetrical. The eyelids look like they're symmetrical. Swelling, redness, or drainage. You almost always want to say in the HEENT section about redness, swelling, or drainage. Okay. Then you would look at the eyelids and say you don't see anything that looks abnormal. There's no lid lag or anything like that. You would pull down the eyelids and look at the conjunctiva. You would speak to that. You don't see anything abnormal there. You would also look at the pupils. You'll see that they're equal. They look equal. And then you'll remember that you have to do an exam on the eyes. You'll do your Snellen exam. You'll do your congruency. You'll check for equal ocular, your movement, your cranial nerves 3, 6, 4. You'll check for that. And you'll also make sure that you check for the red light reflex. You'll do that as well. You will inspect. So now, like I said, it is natural to see that I can see that she has a nose. So I would check her nose. I would make sure that I look for her turbinates to make sure nothing is swollen or anything like that. I look to make sure she doesn't have a deviated septum. So as I'm actually doing the exam, I'm just verbally saying what I see. So whatever I see, I will verbally say. And if there's anything abnormal, I'll make a note of what's abnormal. Okay. If there's nothing abnormal, then I would say it's normal. All right. And then I would look inside the mouth and I'd note everything in the mouth. I would note the tongue, the salivary glands, the any lymph nodes I might see, the oral mucosa, the pinkness, whether you see any redness, any swelling, any drainage. You'll note the uvula. You'll note if it's rising or anything like that. You'll also note, if there's any broken teeth or if you notice any caries or anything like that. So the main thing, you want to take your time. You want to use the person that you're working on to just see what needs to be done. So after I go from the eyes, nose, and in their mouth to look at their throat, right? HEENT. Then I will go on and look at the ears. I would note if the ears are symmetrical. Okay, so you always note that. And then you'll look inside the ears and you'll look for the tympanic membrane. You will note if you see a tympanic membrane, if it's perforated, if the eardrum's perforated, if your bony prominences are there, if anything like that is abnormal, you'll note that as well. And you'll use your appropriate equipment to do that. Okay. You will also remember to inspect everything on the face. So you'll note to inspect the sinuses. So you'll make sure that you do the frontal sinuses, the ethmoid sinuses, and the maxillary sinuses. So you'll touch base on that as well. And then you'll also remember that since you're on the face, you want to make sure you do all of the lymph nodes. So do all of them, including the back, the occipital. And then you'll come right here and keep your hands on the face so you remember that you're still on the face. And do the preauricular, here, postauricular, and come on down your cervical chain and do all of your nodes here as well. So just remember to do that. Now, again, if you don't remember what is on the rubric, just do what's in front of you. And you cannot go wrong by doing what's exactly in front of you, because the person that you're working on will be able to expose what that is. Okay. Now, with an HEENT exam, you don't want to forget the throat. So you'll come to the throat and you'll do everything in the throat. And you want to be sure that you check the thyroid. You want to make sure that you're checking to make sure that there's no swelling, no nodules noted, and that you don't see a goiter in the thyroid. Make sure you do the appropriate exam. If by chance your school is asking you to do it with a drink of water, make sure you do that. So you don't want to miss out on any points with that, okay? You would stand from behind, and it would look like this, and you would touch here, and you would have them swallow while you do the exam, and you would slightly push over and feel the thyroid for any nodules on this side, and then you'll push over and feel the nodules on this side if there are any at that time, okay? So you'll do that as well. Now, when you do the HEENT exam, make sure you don't forget the carotid arteries, okay? You're gonna listen for those, okay? One at a time, not both at the same time. So remember to do that. Because it's here, you know to do that. And don't forget to inspect and say that you don't see anything abnormal. So you want to do that as well. And then with HEENT also comes your cardiovascular system. So of course you want to remember to check their heart. So you want to start with the appropriate part of checking the heart, and you want to make sure that you're doing all points of the heart valves. So in order to remember that, you can just do like a little mnemonic about all patients everywhere take meds. That would be a little mnemonic to remember where to listen to. So you're going to listen first with the bell. You're going to listen to every part, and you're going to say each part that you listen to, and note that it's normal. You don't hear any type of clicks or any type of bruise or anything abnormal. And then you're going to listen with the bell, okay? And this part, you're going to listen for murmurs, all right? And you're going to listen for every single part that you listen to with the diaphragm, okay? Just as you would with your normal nursing assessment. Then you're going to make sure you listen to the lungs. This is all still part of your HEENT exam, okay? So don't forget that part. Now, since all of those systems are connected with HEENT, you're going to also listen to the abdomen, because anything that drains down from the nose will drain down through the throat, and you'll swallow and will go down into your tummy. So you want to make sure that you listen to the belly, okay? So you do that as well, because they may have some acid reflux. They may have anything like that that you definitely want to make sure that you are assessing. Okay. Now, when you listen for your belly, you want to make sure you're listening to all your bowel sounds in all four quadrants for the appropriate amount of time. Now, when I was getting checked off, we had to listen for 5 minutes in each quadrant. Okay. So I don't know what your checkoff will say, but you want to make sure that you use whatever the checkoff says when you're listening. So again, the best way that you're going to remember your assessment is by looking directly at the patient. And I know that may sound easy, but that's the truth. If you get stumped and you get nervous when you're doing your checkoff exam, just relax and remember that everything that you need to say to your professor is right in front of you. And you just have to relax and remember to say it. So just by looking at your patient, just by looking at the person in front of you, whether that be whoever you're going to do your checkoff with at the time, when we go do our checkoffs, students check off on other students. So they'll have a partner that they have for the whole checkoff. So you'll be able to see exactly what you need to check off. And it's really, really easy. But you guys are so nervous when you're doing it, you tend to forget. Because if you've memorized what you're going to do and you've practiced over and over and over, by the time you get to the checkoff, it will just roll off your tongue. So the key to all of this really is first, practice. Second, relax. Third, memorize the check-off sheet to a T. If not the check-off sheet, then the rubric, whatever it is. So in this case, for HEENT, you have to remember everything that H stands for, the head. Everything in the head you're going to talk about. That includes lymph nodes, that includes sinuses, that includes the hair distribution, that includes lumps, bumps, or anything abnormal. That includes everything on the head. Then E for eyes, you want to check out everything with the eyes. If they tell you you need a Snellen chart, make sure you have a small Snellen chart. Make sure you stand 10 feet away or whatever the requirement says that you have to do at that time. Do that at the time. So that's for eyes. Make sure that you look for the pupils, how they react to light. Make sure you're doing that. Make sure if you have to check for a red light reflex, you are checking with the appropriate equipment. So you check with the ophthalmoscope. Make sure you dim the lights and do that as well. Then check for the equal reaction of the pupils. Note what that is. And then go on to the ears, which is your other E. And then you'll check the ears. Make sure you note the tympanic membrane and the cone of light for sure. Do that. Then you'll go to T, which is your throat. And you have to open the mouth to look at the throat. And everything you see in the mouth, just remember to talk about the mouth. And that will be easy to do. Once you've memorized everything, once you get in there, you'll remember. The thing that I realize or that I noticed that students are not remembering when they get into the mouth is to note that if they see if they see the patient's, their tonsils. So they can't remember if they see the tonsils or they don't say the tonsils. And if they don't see them, they normally don't say that they see them. So if you don't see them, note that the patient doesn't have any or just say +1, okay? But you have to grade the tonsils. So make sure you do that. Another thing that I noticed that the students don't do, they don't remember to talk about the uvula. They don't say whether the uvula rises or not, okay? So remember to do that. Another thing that they forget to move the tongue around and lift the tongue up to test the salivary glands, to do that. Now, we used to have to make the students check for a gag reflex, but we no longer have them check, but we have them say that they've checked. So do that. And when you check the gag reflex, be sure to talk about the cranial nerve that it's connected to. And I did do a cranial nerve video, so you guys can check that out. Also, don't forget the teeth. There's so much to talk about inside of the mouth where you can get points checked off if you don't talk about it. So make sure you note their teeth. Also note if they have dentures. So talk about dentures, if they have a partial or if they have full plates, note that as well. Note whether you see if it's moist or not. Be sure to do that, okay? So that's all just by looking at the patient And then just remember their eyes, talk about the conjunctiva. I cannot tell you enough how many uh, people don't remember to check the sinuses. And the sinuses sometimes are a lot of points. So you don't want to lose those points if you don't check for the sinuses. So that's that. When you get to the throat, check everything in the throat and the neck. Don't forget the thyroid. Don't forget the carotid arteries. Don't forget that. Don't forget to check underneath for your salivary glands and all of that. And you can check for the mastication of the jaw. You can check for any type of TMJ, all of that. So if you just take your time and just relax and think about that, you can do all that pretty quick. And I actually did it all in 20 minutes, and I'm still kind of talking about the same stuff over and over. So you want to make sure that you are relaxed and you do that. Now, the exact same thing that I did with the physical exam, the physical assessment, you want to do that with your history when you're taking your history. And I'll do a separate video on that because that's totally different, and it will take a little bit more time. But you want to make sure that you do that as well. Now, again, remember when you're checking the ears, pull on the ear, tug on the ear, push down here on the ear as well. Make sure that you're doing that. Don't forget that because they might check you off, subtract some points for that. Do that as well. So those are the things that I see a lot of times. Oh, another thing that I see that people don't do, that they forget altogether, is to do the cranial nerves, because HEENT also includes all the cranial nerves. So if I were you, the way I would do it, and some people do it differently, but me personally, I like to do my cranial nerves after I've done the whole exam. I don't like to do it at the same time. The only time that I will tie it in is if it's natural. If it's natural to tie it in, which would be if I'm checking like the TMJ, then I would tie that in. If I'm checking the eyes, I would tie in the cranial nerves for the eye as well. So 2, 4, 6, and 3. So I would tie those in. If I'm doing the nose, then I might pull out alcohol and do the olfactory and do that at the same time. I'll have them shrug their shoulders, turn their head left to right. Of course, I'll do that. But if I cannot remember to do it as I'm doing the exam, I'll do it after. Now, when you're trying to do your checkoff or remembering when to do your checkoff, do it the same every time. Don't try to do anything fancy. If you did not practice it that way, do not perform it that way. Do it the way that you practice. So if you practice a certain way, when you get to checkoffs, do it that exact same way over and over and over. And that way you'll get all your points, you'll get all of the exam. So I guess my biggest tip to you guys going forward, when you're doing your exam for checkoffs, okay, this is just for checkoff purposes. And you'll learn how to do an abbreviated version of the exam. Once you get into practice, you'll abbreviate it. I promise you. You'll learn how to do some abbreviations to it when you do an episodic. But my advice to you is that if you get to the exam and you're that type of person that just freaks out during the exam and you cannot remember, then just look at your patient. And your patient is your cheat sheet. They will help you cheat because everything's right there. And you guys completely forget that. You guys will get there and stand in front of me and you will go blank. And I'm like, how can you go blank? Everything you have, everything you need is right here. It's right here. All you have to do is remember what the professor wants off the check sheet. Okay. So whatever your rubric is, whatever your check sheet is, memorize it and learn what points are worth what. And if you don't think you can remember everything, just the little stuff, then you don't remember. But again, your cheat sheet is right here. Okay, so Crystal says, thank you for the information. Currently in Nurse Practitioner School, second and last year in my skills lab. we're doing HEENT. So it so happens to run across this live. So awesome. Oh gosh, thank you. I'm so glad you're here. Do you have any questions? Is there anything that's tripping you up, or you have anything you want to ask me, since HEENT is the section that I check off? So we'll give you a second if you have any questions. So honestly, guys, I'm going to be honest with you. I feel like if you can learn each section in chunks, like HEENT, if you can learn all of that, if you can master all of that, then you're great. And then if you will go down to, no, you've covered everything. Okay, good. If you will go down to, oh, and another thing, guys, every single checkoff, whether you get like a chunk checkoff, like a HEENT or abdomen, or I don't know, they might give you dermatology or something like that. I don't know. But every single checkoff will look at or make sure that you do their general presentation, how they look, if they're alert and oriented, what they walk like, how they got onto the table, and they will do heart and lungs. Every checkoff, heart and lungs. You will never touch a patient without doing heart and lungs. So just remember, every patient or all patients take meds. No, gosh, forgive me. All patients everywhere take meds. That's if they want all 5 points or all 5 areas of the heart. If they only want 4, it's going to be all patients take meds. And those are the points on the heart that you want to assess, okay? And you want to listen to lungs always, 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 because you'll get in the clinic, you'll get a patient who comes in for a sinus infection, and then at the end, they're going to say, hey, you know what? I've been having chest pain for 3 days and my arm feels numb. But you didn't listen to the heart. So you don't want to get caught up like that, guys. So either way, guys, I think that we've covered everything. Mr. King, do you have any questions for me? I see you've been here the whole time. Did you have any questions before I go? I appreciate you staying. Anybody else have any questions that I can answer for you? Okay, so I wonder, is there anything else? Let me check here. Make sure you check for symmetry. Symmetry, symmetry, symmetry. Everything is symmetrical. Eyes are symmetrical. Ears are symmetrical. Legs, everything symmetrical. Just make sure you remember that. Everything's symmetrical. Practice, practice, practice. Memorize the rubric. All else fails and you can't memorize. Here's your cheat sheet. Your patient. Okay, I think I've gone over the same thing. I don't want to beat a dead horse. I don't want this to be boring for you. I want you to get something out of this. I've enjoyed being here tonight, guys. That's all I have. Hit that subscribe button, hit the like. If there's anything you guys want me to talk about, Crystal, if there's anything I can cover. Tonight, I covered this for Boss IG Live, who asked me to do this video. So I covered that. I think the next live I'm going to do is how to study successfully in nursing school or nurse practitioner school, or how to deal with the pushback from doctors and nurses in your role as a nurse practitioner. So, hey guys, just give me some comments, and I thank you so much for being here. And I am signing off. I'm tired. You guys take care. Thanks for stopping by. Bye, guys.